Every year, 50,000 women in the United States almost die due to pregnancy-related complications. All this week, we have been highlighting the alarming rise in maternal deaths all across the country, many of which are preventable.
10 News anchor Heather Wallaga takes a closer look at what Tennessee is doing to keep mothers alive.
Inside this operating room at UT Medical Center, a hemorrhage chart maps the steps to keep a patient from bleeding out during delivery.
Reminds us, this is the list, this is what we've done, here's some other ideas.
It's one of the new protocols put into place at the Knoxville hospital to save mothers' lives. Dr. Kimberly Fortner is the medical director of obstetrics.
We could all scream from the rooftops, please, the mother is not an incubator. We must remember that the mother matters.
Out of more than 18,000 live births at UT Medical Center, the hospital says there were no maternal deaths from 2013 to August 2018. 10 News asked for data going back 10 years, but the hospital declined, citing patient privacy. Across the country, the number of U.S. mothers dying during or after childbirth is staggering. According to the Tennessee Department of Health, from 2012 to 2016, 370 women in Tennessee alone died from pregnancy-related issues. Since 2016, that number increased 21%, and it's affecting Black women at astonishing proportions.
I think as we share more data and understand details, we can begin to find answers to real questions, like, is there a healthcare disparity? Yes, probably. If so, what's it coming from and how do we address it?
There is no national tracking system for childbirth complications, but some states are now taking matters into their own hands. In 2016, Tennessee passed legislation to establish a maternal mortality review board to investigate how and why women are dying from pregnancy-related causes and complications. Medical professionals say there are a number of contributing factors, some not directly related to pregnancy.
It's very multifactorial, and there's not one solution, and it takes multiple partners in multiple sectors to really gather around and partner to fix this for our state.
The review committee is made up of members across Tennessee, all with different professional, racial, and geographical backgrounds.
We were quite intentional to make sure that we've got multiple perspectives as we're reviewing each case.
Other organizations like ACOG and TIPQC are now taking similar initiatives to address maternal deaths across the state. But ultimately, it's up to hospitals to decide to take action.
We're really trying to get the word out to hospitals to be able to engage in very measurable projects and bundles that they can implement that we hope will impact quality care.
Right now, there's not enough data to determine how and why moms are dying during and after childbirth in Tennessee. The Maternal Mortality Review Board meets again in December. Members hope to have specific data on maternal deaths at the beginning of 2019. Back to you. And you can find the entire Mothers Matter series online now. We also have a checklist of the things you should watch for in the delivery room. That's at WBIR.com.